Hey guys, recounting a story from today. So I had a patient, today was maybe visit 7-ish. I saw him 3 weeks ago for visit number 1 with a script for low back pain. This guy's been through 52, maybe 53 when I added them all up sessions over the course of the past year and a half of physical therapy. Big picture, his pain was never any better. And he actually came in on the first day and he said, I get the feeling that the only reason why I'm still in therapy is for job security for the PTs. Patients aren't dumb, all right? They can see this. And this is piggybacking a little bit on Jerry Durham's message yesterday, or maybe 2 days ago, about you can't be profit-driven and patient-centered at the same time. This it's kind of scary, because this guy came in for low back pain, and in 2 visits, his pain was abolished. He was able to, to abolish the symptoms and return back to all of his function within 2 weeks, 2 visits. All I did was remove all the flexion that he was doing throughout his day. He's already doing enough flexion throughout the day, and he noted that every time that he does these exercises, he gets back pain. When he stands up taller and he bends backwards, his pain comes back, or his pain goes away. And so that was very simple. I just don't bend forward as much and bend backwards a little bit more frequently. And he's back to playing golf. He's done everything he wanted to do this past week, and he didn't have any back pain. That's awesome. Next, he's like, well, since you treated my back so well, how about you look at my neck? Okay, that's cool. He went to see his doctor. I got a good relationship with the doctor, so he went to go see his doctor. Comes back for neck issues. Now, the neck took me a little bit longer. Within 3 visits, I realized that I wasn't going to really help this guy. I could teach him how to manage his symptoms, which in the end, he was pretty satisfied with. I could teach him how to manage his symptoms, but I couldn't really shut his symptoms off permanently. And, he presented very mechanical. With one exercise, the symptoms turn down or off, and, if he comes out of that position and goes in the opposite direction, his symptoms return, almost like a stenotic lesion. But, it doesn't matter what it's called. I couldn't turn his symptoms off and keep him off. The guy's very active. He's been very compliant. And after 3 visits, I realized there wasn't much else that I could do for him. Any more visits would simply be, financial gain for the company that I work for. And it wouldn't be right patient, right therapy, right time, which is what we should all be striving to do as a profession. There's a lot of talking going on right now in some of these private forums about, the pain will get better over the course of 6 to 12 months. The pain will get better on its own. We just need to educate the patient about pain. Some pain will get better immediately, if you give it the right exercise. Some pain can churn off and abolish, and, the patient can't reproduce it if you give them the right exercise. And so that's where, some patients may get better over the course of 6 to 12 months, but some patients may get better faster if we intervene with them. And so I'm also not of the ilk that I'm just going to let the patients go and experience pain, and I'm just going to teach them about pain and teach them that pain, that hurt doesn't always equal harm, because the patients are coming to me to try to get them out of pain. 90% of the patients that come to PT are coming because of pain. So I think that was Adam that just popped up on the screen. Thanks for joining. 90% of the patients are coming to us because of pain. And so if I just tell the patient, well, wait and see, it'll get better, that's true for some of the cases, but a lot of these patients have been dealing with it for a while. Now, I can see where, hurt doesn't equal harm. There's a lot of pain science that has to go into it, and a lot of that has to do with listening to the patient, understanding where the patient is at their stage, at this stage, and not only their injury, but in their life. We have to understand how much fear may be playing a role in their pain, how much their thought process may be playing a role in their pain, and how much the patient may just be habitualized to having pain. And so there's a good phrase in the book A World of Hurt. I reference it a lot when I'm talking to patients and other students is that sometimes you have the fire alarm going off without the fire. And so a patient can have pain even though there's no specific damage done. But sometimes the patient has pain because there's some damage. And if there is, I'll use the word damage because it's the easiest word to use, but sometimes there is something that is causing the patient's pain that is mechanical. And in a lot of cases, and depending on which articles you're referencing, sometimes you could see a 70 to 80% prevalence rate of a mechanical symptom. And so in these mechanical patients, sometimes the pain can be turned off with a simple exercise. And so I don't want to go down the rabbit hole of pain science and teaching them about hurt versus harm when we can actually give them one exercise that shuts off their symptoms. Thanks for watching. If you have any questions, put them in the comment section. Have a good night.